Welcome and thank you for joining us today for the 311 of 988 4911 session. My name is Sandy Dyer. I'm from the DataMark team, and I'll be the moderator for today's session. Before we begin, I will let everybody know that we are recording this session. It will be made available to you as an attendee, I believe after the conference closes. All attendees have been muted for quality assurance purposes. We do encourage questions through the use of the chat and the Q&A section of this platform. We'll go ahead and handle questions at the end of the session. That way Mo has plenty of time to be able to share the information that she has. I'd like to introduce today's presenter. Her name is Maureen Beekman, although as I mentioned yesterday, most of you probably know her as Mo. Mo, can you share a little bit about yourself, please?
You betcha. And also, Sandy, I turned on my timer so that I can manage the time well. Good morning, everybody. My name is Maureen Beekman, but everybody calls me Mo. Today, I am presenting with my vendor hat off and my volunteer hat on. And we're going to be sharing some interoperability and interaction working group updates from the NINA working group 988-901 Interactions Working Group. And it is under the operations section of NINA if you're interested in what committee for further information. I've been in the industry since 1994 and talking a lot about technology. As a matter of fact, some of you remember when I was a trainer on going from basic 901 to enhanced. And we were all talking about the number of characters that were in any and alley data sets and how to chop that up. And to flip all these years forward, giving up my age, it's so enlightening to see speakers sharing data, to be able to see it on a map and see pictures and answer phone from the map and see apparatus moving and find location identification across county boundaries and across state boundaries. So it's very exciting to see some of that happening, and I'm excited to look at other industries that are also collaborating. And so what brings us together today are driving forces of different industries and different types of numbers. So you might be familiar with 411, you might be familiar with 311, obviously familiar with 911, but there's a lot of numbers up there that drive the public to go to a certain place for a certain thing. 211 driving for healthcare information. And how do those industries light up a number and interact with an emergency routing number? And some of that's no interaction at all. And some of it, they kind of go back and forth a little bit, or they are aware of each other. Sometimes, like down in Louisiana, they're even in the same center, 311 and 911 together in the same center. So you'll see some of those operational considerations grow across boundaries and share information. So what does that tell us for today? Today we're going to talk about 988 and 911 interacting. There is a working group under the operations and logistics committees in 911 in NINA, and I'm one of the co-chairs along with Jenna. Let me back up a second. Jenna Streeter and Cherie Bartram, and our chairperson Pete Egeman, and put together a working group, and our NINA oversight staff member is April Hines. And we have quite a few members in the working group. I think we're up to 112 actually. And several people from 988 and the 911 industry collaborating together. So why the working group came together is to provide, and the purpose of our working group is to provide call and information sharing solutions to emergency communication centers and to 988 call centers. And then some of you are like, ooh, 988 call centers, they exist. And for those of you that don't know what 988 is, let me just do a quick recap. There is a 1-hour video in the NINA working group resources that dives deeply into 988, how it came to be, and the interactions of 988 and their purpose and their roles and responsibilities. I'm not going to do a 1-hour video on 988 today, but I can give you just a little recap. It is obviously the 3-digit dialing code that directly connects your community to the existing National Suicide Prevention Lifeline network of crisis call centers. Those call centers have existed for many years. Some of them go back to 2005. This is where folks go to get free and confidential emotional support, crisis intervention, emotional distress, 24 hours a day, 7 days a week throughout the United States. And so since it's been around for a long time, why are we dealing with it today? It is because the national network is moving the National Suicide Prevention Hotline to a 3-digit number. And so in some areas, it has not been 988. There is some resources for you to go get education, and I'll talk about that in a minute. But this lifeline has been funded by the Substance Abuse and Mental Health Services Administration. And the short of that is called SAMHSA, SAMHASA. There's a big meeting on Thursday by SAMHSA that will be educating people on partners and how 988 is deploying. This network, 988 and the Lifeline Network, is a national network of over 200 local, independent, and state-funded crisis centers equipped to help people with emotional distress. The 988 provides compassion, accessible care, and support for people who might be experiencing suicidal thoughts, who are at risk of suicide, who are struggling with distress, and may need mental health support services. The reason we're interacting is 988 is the new phone number for an existing service. And so you have already awareness of the National Suicide Prevention Hotline. Already there's a national standard built by NINA and in collaboration with the Suicide Prevention Hotline folks. So our modeling for the 98891 interaction standard is on the foundation of the model of the Suicide Prevention Lifeline standard that already exists. And the reason that we're moving quickly along in our standards development work, and I'll talk about the timeline in a minute, is because after July 16th, 2022, dialing either phone number will get people to the same services. 988 is going to be simpler for people to remember. It will have a PR campaign around it. It will be a way for Americans to access nationwide. And it will also strengthen and expand a network of local resources to have national support and a national network. Text services will also be available via 988 by the same date, along with already existing Lifeline chat service that exists, and that's instant messaging. They will serve as a universal entry point, so any individual in the country will be able to dial. Trained counselors exist. Over time, the vision is to have additional crisis services available in rural communities and start expanding into other areas. Of course, 988's role in relation to mental health response will need to be assessed. We need to understand what we're currently doing today. And as you all know, it's a little disparate. What we do in Washington might be different than what we do in Minnesota, might be different than what we do in Florida. So we will first say that the standard that we're creating between now and July, which is a very tight timeline, it normally takes 16 to 18 months to create and flesh out a very detailed standard. We have to determine the use cases in each area and how states will interact 901 and 988. Now, that has brought up a lot of questions. So stay tuned, because I have a whole list of questions and what we're addressing in the standard. And I'm going to show you the work that people are going through as they create the interoperability and the interaction processes. We're also going to elicit 988 and 911 professionals to determine types of response. Imminent threat is a piece of that definition. How do we assist in de-escalation? The safety of the caller and the bystanders. The other thing that we'll be taking a look at is the wellness and the impact and the stressors that are on the call taker and the dispatcher. And and by the way, I know what kind of conference I'm presenting at. And so we must understand location will be important. So I'll be talking about that as well. And I know you're all like, how did they find the location? And I'll get to some of that. Local resources, response models, and mental health protocols all are going to play into this. And for those of you that heard me talking about staffing yesterday, some of this is going to have an impact on staffing. I'll get to that in a minute. So I already mentioned collaboration with technical and operations professionals. We have separated the operations from the technicals so that we can both crank out work at the same time and be productive. The operations working group, if you're interested, meets on Wednesdays, every other Wednesday, and the technical group meets every other Wednesday on the off Wednesday of the operations group. And we are creating uniform best practices to identify each entity's role and responsibilities, and then also to identify the training that is going to be required in both entities and how they both operate, and what kind of changes in technology or changes in operations can we tweak to make this a smooth, interoperable process if we are going to define how they interconnect and utilize resources, especially when it's related to text routing and call location. I'm just going to pop this screen up, and I think Sandy also is going to pop it into the chat. This is like an 8-hour meeting, but we have 45 minutes. And there are already resources and areas for you to go get information. And if you're interested in what's happening in your state, you navigate to your state director or your state administrator or the person that's overall your state, and they are typically going to be able to direct you to a 988 coalition and interoperability meeting that's occurring in your state. We also, if you have questions on 988, 911 interoperability, have speakers from NINA and from our working group that will come and present virtually to your 988 and 911 coalition meetings, the updates and the status of our working group information. The deadlines, I already mentioned this, and so we're under a tight timeline. If you want to contribute, you get to join properly the NINA working group. The executive summary, we're pretty well finished with that, rolling through the role of 988. We're into final edits on the definition and the creation and timeline and the role of 911 in public service related to the mental health events and public expectations. And what we're doing on our working groups is writing and then editing and redlining and creating it to be ready for public review and comments. So even if you do not join a NINA working group to create content and you are a NINA member, you will be able to read it when it comes out for public comments and comment on it and make edits. And we have to review those edits and those comments, even if it's correcting English grammar, which hopefully we have done before it goes to public comment. And you have an opportunity to weigh in on it before it gets posted and voted on and becomes a standard. So you don't necessarily have to join and work on the working group. You can wait for it to come out and comment. However, if your comments are 1,000 words, you're going to kick it back into the working group with a lot of work. So just be careful how you comment. The cooperation between the 988 and 911 call centers does have a summary of goals and a summary of risks. Obviously, location identification and who's allowed to see certain locations and information, whether you've waived your privacy rights or not, that matters. There's also going to be memorandums of understandings, and those of you from comm centers already know that they exist. An MOU for how agencies interact with other agencies and departments within their city exists. MOU templates are being developed with how you interact with 988 resources and your local resources. You'll also have agencies that are putting mental health professionals into how they dispatch, sometimes even into the car when they dispatch. And you'll see protocols where there's requirements and boundaries around what people are doing. Because the standard's being written right now, we're not saying that you need to go change your SOPs and your protocols or do anything different than you're doing today. What we're saying is that you need to be aware of the timelines, your local resources, and start weighing the impact and assessing if there's any changes or needs to make any interagency agreements a little different than they are today. The interaction and goals and risk will help you define your current SOP and your current policies and then future state. So when we write the standard, we're writing a version 1. How is it today? What are the use cases? Where can you go get resources? What are some of the templates you can use in different use cases? And how do you interact today? There is a separate parking lot for version 2, which is future state. Where do you see the future of the interaction, sharing information between the two? What could happen if we got location identification and 988 was an emergency routed number? What could we share with each other? That future state and that amazing technical thinking is going into version 2. And so we're parking things in there. So if you're an innovator or whoa, what if we did this kind of thinker, you can join that technical group and start plugging things into that version 2 future state. The current state's also going to talk about transfers, the end user experience, and the analytics. And for you analytics geek heads, it's probably not the proper term, and I'm being recorded. So analytic technical professionals, how many of these calls are going to come in? You know, when we rolled out text to 911, folks thought it was going to be a flood. And in some cases, it was a trickle effect. And so we do need to look at operational analytics, how many of these calls are coming into 988. They already know their analytics and their de-escalation and how many convert to imminent risk and need to be transferred to 911 or 911 engaged in response. And so then the operational analytics in 911, how many of these are going to come in, any more than we already have today? Or, you know, there's going to be some use cases, and already in some of these meetings, we're hearing about the time it takes to look up and find someone. If they do not share their location with 988, that's going to prove to be a difficult process. And how often is this happening? And the cost impact to agencies with their states. And if you have MOUs where you're billing for dispatch or being billed for dispatch, what's the impact going to be? And so those operational analytics, we're going to have to flesh them out. That's why use cases are so important. You know, some areas of the United States aren't even enhanced yet. And now we're going to talk to them about location identification for folks that are going to be difficult to find if they don't share where they are. Then, of course, as you roll out SOPs and policies or put something into a center that might be a little tweak to how they're doing it today, or a major change or a significant shift in their call taking processes, we're going to have to take a look at the training and 988 staff training recommendations and 911, as well as the wellness impact for folks that have very long calls with a suicidal caller and the de-escalation. The wellness impact on the call taker can be tremendous. And that vicarious trauma can also be adding to their stress level. So we don't want to minimize the impact on the person that's going to be handling these calls. Now, 988 has some pretty tremendous statistics on de-escalation, and then how they're able to help folks. And they have some pretty significant statistics on the number of calls that they're taking. So the PR for this should also serve 911 to reduce some calls and sending them over to 988. So I think that you're going to see a little change in a couple of different ways. Interoperability, but also directing the public to a place where they can get help and anonymous help. And sometimes on chat, instant messaging instead of voice, which to have a center like that that can accommodate all kinds of conversations, confidentiality becomes a a big thing to the person asking for help. And so you'll see some pretty enlightening and eye-opening services provided to those with mental health distress needs. Technical considerations, of course, I just mentioned the technical operations group that meets on the off Wednesday, dealing with Annie and Ally system equipments, location identification, and transfers. So transfers is a very vague topic. So let's kind of dig into some of the questions that folks are addressing in our working groups. Location and lookup parameters. And hopefully you're all sitting down, because some of the resources in this industry are looking up based on area code. And I can just hear all of you number portability fellows going, area code? Well, we move our numbers from state to state, and that area code can go from Chicago to Walla Walla, Washington. Brooks got me on Walla Walla this morning because it's wine country. But somebody can move their 312 area code out of the Chicago area and go into Washington and dial for help. And if you're looking up the area code 312, you're going to be looking in Illinois, and that might not necessarily be proper location identification, but it is doable. And how do we share information, and how can we tighten that up so that if a call comes into 988 and they need good location identification, if they do transfer to 911 and they don't have an address, how can we look up and prepare to respond properly for someone that has imminent threat or imminent risk? Transfer to and from the 911 environment. Do we see that happening? And there opens up dialogue in the working group. Will 988 transfer to 911 or call them and give information? Will calls go from 911 to 988, and which will need to include, if the caller is transferred, what if that turns into something that needs dispatch and it needs to be transferred back? How do we stay on the line? So there's, for those of you in comm centers, you understand that sometimes you transfer and stay on the line and help and talk with the other agency. And sometimes we transfer and then we hang up and the other agency has the call. And does that call come back? And so there's different types of considerations. Sometimes you hear people call them warm transfer, cold transfer, blind transfer, or managed transfer, or shared transfer. There's all different terminologies, and really there's not too many terminologies, but you want to get the definitions of those clear when you're dealing with another 3-digit entity, because the definitions aren't always the same, and we got to get some alignment there. Practical application of that call sharing for the end user. What do they hear? For those old dogs in the industry, you remember you used to have a lot of clicks and beeps, and people would hang up thinking you hung up on them, and you'd have to start the process all over again. Sometimes you didn't hear anything at all, and the end user thought you were gone, and they'd hang up and start over again. Sometimes you're able to share information and you can hear everything. It just depends on where you are and the equipment. Oh yes, unless it's a wireless call. Baseline information being gathered by and shared with 911 and 988, such as Annie Alley and callback number. What information is allowed depending upon who answered the phone. So it is possible, if technicalities get ironed out and we figure out ways to route the numbers properly or differently, I shouldn't say properly, but route the number differently. A number can have a location identification attached to it, come in front of somebody that doesn't have permission to see it on their screen, get transferred to someone that does have permission to see it on their screen, if you're running a number through a couple different 3-digit entities. So you can really work out some of these technicals to be permissions based. So when we think, let me just see what Sean's saying, having a 312 in Washington will probably be a VoIP system that someone took from the 312 area code, which would have an IP address, which tracks locations. And Sandy's correct, unless it's a wireless call and I'm moving around. But also, I think on voice over IP, just to not to go down that tangent, But if I put this desk phone that I have here on my laptop, and then I fly to Miami for a conference and I dial from my laptop, it'll look like I'm in Denver, because when I landed, I didn't stop and tell my VoIP provider I had a new location. My VoIP provider is going to provide the location that's on my billing address. And that's what they keep telling me, is to just stop when you land and change the address on your laptop, except that last week I was in 4 different cities, so I didn't change it at all. But if I dialed, it would look like I was sitting here at my desk. No, Sean, they didn't use the IP address. They're using my billing address. So there's going to be some disparities in information and sharing. Information asked and answered in the CAD notes. How much is shared if the call is transferred from one entity to the other? And is it even possible to share that information? So there's also some processes, agencies that call back people that hang up or abandon a call, policy recommendations for remaining on the line or passing off calls. Those things need to be addressed. They need to be assessed, status quo, or do we need to make changes? Other questions that are coming up, protocol adjustments, if you're using protocol software or pre-arrival instructions. And as you know, there's homegrown, there's industry pre-arrival best practices and instructions. There's cards on paper. There's cards on laminated cards. There's software. There's fire. There's law. There's medical. In some areas, it's mandatory for law to go. If that's an SOP-based protocol, and then medical also goes, that has a pre-arrival instruction. So there's some weeds that you could get into on protocols. The important thing is to pay attention to how you're currently doing it today, continue to do it that way today, and pay attention to the things that are coming, so that if you have to make adjustments or changes or get permissions to make adjustments or changes, that you start paying attention and be aware of the work. Agencies that have routing or automatic call distribution, push 1, push 2, ACD, and sending it out to different positions. Those types of technologies need to be paid attention to as well. Interagency agreements, I kind of already talked about that. Processes, I kind of already talked about that. 988 agency type or assumptions in a descriptions list. You guys sometimes know your local resources. If those local resources get scooped up into one number, the call might be going farther away outside your city to 988 call center, and then coming back and being able to establish who is going to help those folks in the network and outside the network, and making sure that you're not creating risk and liability by going outside a process. Does an agency have dispatch capabilities? Are they going to have a mental health professional available to go out with medical? And in some cases, the answer to that is yes. And in some cases, the answer to that is no. And I already talked about training, so I don't need to spend too much time on that. After hours protocols, you guys in some areas of 911 have agencies that shut down at 5 and you take their calls from 5 till 9 in the morning. You're going to have similar scenarios in 988 if some pieces of their centers shut down. Now, most of their centers operate 24 hours a day, 7 days a week, 365. And as they scoop up local resources, you might have some use cases that need to be paid attention to as they try to use centers to cover an entire state. Some of you have state legislation and rules that are moving along in how you do state coverage. So it's very important to pay attention to states that are very progressive in this area and try to find modeling that suits your region. California, as an example, has 13 988 centers up and running and interacting with in various ways and doing pilots with 911 centers. And then Minnesota also has a set of 988 centers that have come up and they're starting some interaction. And then there's also some rules around mandatory dispatch, whether you include law or don't include law. And so as you look at your architecture where you are in SOPs and protocols, it's important to follow those rules. Analytics, we already talked about that. The other thing is CAD systems are also becoming progressive in the area of understanding the types of calls and whether to trigger a professional to pay attention to the fact that this type of incident happened. And a professional can be a peer support person helping the call taker or dispatcher because it was a mental health distress call or a suicide prevention call. And being able to come in and look at a traumatic event or a need for peer support and put CAD triggers in there in order to help the professionals so that their management team can see it happen, even if they weren't on site and able to see that it was happening real time. Cross-referencing some of that information over to your CAD configuration because you're aware that it's possible will help you keep some of your systems in line with some of these changes as well. Okay, so the other thing that this type of technology pops up is i3 architecture and all the possibilities of amazingness when you think about sharing information on networks and having the states be able to transfer calls even across state lines or across different types of networks. And I'm pretty sure a technical guy is going to come and slap me for how I just said that. But I speak English and I don't always speak i3 architecture, but I can tell you version 2 in the technical part of our operations working group is really going to dig into, if you're on an i3 network, what are the possibilities for proper delivery and treatment of transfers, and the guidance and advice that's coming from i3 technology experts is nothing more than mind-boggling when you hear them talk about the potential of being able to deliver and treat transfers and location identification in a different way than it is today. So that version 2 is exciting and also futuristic and also necessary. So I think important to pay attention to evolution of this particular standard. Once version 1 is done, to pay attention to how version 2 is going to evolve. So that's the update. We provide that update at the NENA Standard Best Practices and Critical Issues Forum in San Diego a few months ago. And then we're providing this update and the access to information in 988 and 911 coalitions in Vermont and Florida and Minnesota and Nevada and California. And so you'll see some topics popping up. You'll also see some vendors popping up to support some location identification. And you're going to want to understand how they all play, because there's going to be technology that's going to start coming into this space to help people figure some of those things out. Vibrant was tasked to roll out 988, and they are the management of the service that's being delivered in 988, and they are participating significantly in the working groups with how 988 call centers actually work. There's also folks that are participating in location identification and best practices on how to look things up. So if those things are interesting to you, by all means, feel free to get questions or just go read things for the resources and be aware of it. And just pay attention to the presentations that are popping up at some of these conferences to figure out what you do need to do and what you don't need to change. And then I would just map it, and much like text to 911, it's not going to be a fast process, but it is inevitable and imminent that it's happening because it is being driven by the FCC and the rules that they've made and the deadlines that they've put into it. So I'm one of the chair people. I'm not the only one. Jenna Streeter, Cherie Bartram, Pete Egeman is also on our technical and operations meetings. And then if you're needing understanding on how it's at a state level, you all have state folks. Well, there's a couple states that don't, but you can also talk to April Hines, who is the NENA staffer that is our advisor for this particular working group. But she also presents on behalf of Nina and 911 to 988 partnership groups to make sure that everyone's understanding. One thing that we are not handling, because this is usually one of the questions that pops up, so I'll just nip it in the bud. This working group does not manage where the funding is coming from, nor tells you how it's being funded and where that money is coming and going. Because each state's doing it differently. And there has been some squabbling over who's going to tap into 911 funds, and does it take away, does 988 take away from a 911 fund? And there is some concern or even a little bit of worry. And there are some precedents being set and some places to go to get that information. The other thing, so I would contact Nina, and that's in your chat group if you have any concerns about that. But the other thing that's important to note, especially if you go to SAMHSA or NAMI, which I didn't spell correctly in my head, so I shouldn't spell it out loud. SAMHSA also has, and you'll see it pop up in our NINA working group, there are entities that put free resources out there for you, including training and free resources in understanding the SOPs and the protocols and the MOUs. And I think it's people building templates and trying to help both entities work together. SAMHSA is a very good resource for that. So is NAMI. And you can always reach out. We'll give you the links and send you to the people. Because of the presentations at conferences like this, you will reveal, or somebody will hear while somebody is working on that. I wonder if they know about this working group. So it's always good to network and get your feelers out there. Just by doing presentations like this, we figured out that the Paramedics Association is also working on mobile response units and mental health professionals helping their mobile response units, and being able to respond in that paramedic space with an awareness of mental health, and inviting them to participate in this working group so that they are on the same page with anything that's being dispatched, and not running off and doing it on an island where we don't know that there's possibilities to have a mobile response team dispatch. So the more people that are aware and on the same page, the better it will help your local dispatch resources. And especially if some of this is funded, you have the opportunity to get some mental health resources, and not all of it is going to cost every agency in certain areas like training or templates and support. So I encourage you to, especially if you're at a comm center, to reach out and gather information, if only to be ready for it and see if there's significant change, little change, or no change at all, and put it on your worry about it later list. Just make yourself aware of what your agency is going to go through and how they're going to interoperate. So I think good to answer a few questions. I think I have about 10 minutes left. I wanted to give you a few minutes between us and the next one because it's lunch hour in some areas and you can have a break. What kind of questions? Any, Sandy?
So I personally have one. You and I have talked about this before and was wondering if maybe the working group is taking this up. So I generally my PSAP experience is in rural parts of the state. Mm-hmm. And in rural areas, mental health providers or emergency response mental health providers are few and far between. So if 988 is potentially transferring to 911, where law enforcement may not be the best response to support that person, what types of resources are being discussed for areas that don't have the capacity of mental health assistance? I mean, with 988 being this type of topic and being, if I understand correctly, a federal mandate, right, for states. Mm-hmm. What kind of effort is going into making sure that resources are available?
Oh, there's considerable efforts and considerable funding in building up the 988. So if you just take state X, I don't have the map up in front of me, but there is a map in the 1-hour video that shows you the 988 resources. So you could look up Arizona and see where 988 centers actually exist and how many. When if the call, let's just kind of bring it down into the weeds just to run your example through an actual, if someone dials 911, what are the resources available? And that's where your SOP and your policies on how you dispatch today, how do you deal with it today? And what do you dispatch today? You're going to stay that way until you change your SOP and your policies. And what if it's a change to transfer that call to 988? And do you stay on the line or not stay on the line? And so what if you do transfer it? Do you stay on the line or not stay on the line? The second thing is, what resources do they have to help that person? They have incredible resources and training, and their percentages of de-escalation and helping people and resolving without it escalating to imminent threat, where harm will be done to the person or others. Their percentages are they're astonishing. And they actually have millions of numbers of calls, and the percentage is like 2 to 5% that go into imminent threat. So if you do build out a practice or an SOP where you transfer to 988 and they de-escalate, you'll be able to use that as a resource to diffuse. But today, you would follow the SOPs that you have today. And if you want to develop resources and training in transferring to 988, or if you collaborate with your EMTs and the Paramedics Association to get a mental health resources that's part of your dispatch, there are mental health professionals coming into the comm center to work in the comm center to take the call. There's also mental health professionals being developed to dispatch with an EMT or with a law enforcement in the car. So you're going to have the opportunity to see what could be done. And if there's no resources because you are so very rural and you transfer to 988 and it's hours away, how do they know how to get help 2 hours back into your rural community? So that's why you're going to want to start interacting with what's going to happen with that 988 center. Do they know you, your PSAP, your resources? How do they engage those resources? You're going to want to start collaborating. If you do transfer the call and they kick it back to you, what are the resources that you'd be able to send? So today you do it the same way you're doing it right now. And tomorrow you're going to want to be planning for how it might be different or revised.
Okay, so then reaching out to either your state 988, or if you don't have one yet, reaching out to either another organization or another state 988 to maybe find someone that can help you out.
Well, actually, Nina's directing you to, and slap me if I get this wrong, because you know that I know it, and I might say NASNA. Did I get it right?
NASNA, yes, the National Association of State 911 Administrators.
That's where you have to go first, because they are, and there's a couple states, I think Nevada's one of them, that doesn't have that. But then we send that person to April and 988 resources to get them some help and understanding. But those people are on the working group. So if you want to know how Arizona's doing it, you go to your NASNA person, and then they know, and they filter down to the 988 911 coalition meetings, and they exist.
Okay.
So there's people meeting, and there's people coming together. Unfortunately, as the world turns, there's some of them are doing it in a silo, and 911's doing it in a silo, and that's why publicizing the working group and getting them to start talking to each other is an important piece of it.
Okay, so I dropped the NASNA website into the chat, and I went specifically to the contact the state 911 contact. So if anybody's needing those resources, if that's where to start. Okay, fantastic. And then
also go to the resources before everybody writes to April, because we're not wanting to send all the emails to her. There's resources to get information and for your state. And there's also resources on 988 to just get understanding, but you don't want April to do education of everybody when they could go read the National Suicide Prevention Hotline standard and answer questions. Or, email, and we'll send them to SAMHSA or NAMI, and you can go look up resources and talk to people. Really, April is our oversight and our NINA advisor, and she will present at a meeting, like on Thursday, the SAMHSA 988 partnership group, and she'll present on behalf of NINA 911 to 988, but you don't want her answering every single question.
No. That's why I was asking where that process started. I apologize that wasn't clear to me if you had already.
Oh, no, it was clear, but make no mistake, when you have a large attendance in an audience, they grab an email and write. Yeah.
Okay. So then the only other question is, can you transfer to 988 today?
Well, that's a good question. I think it'll depend upon where you are and if you are already working with a 988 entity. I would say that there's a lot of workflow going on in California. There's also some requirements being built out that's going to make transferring sticky in a couple of states. So you definitely want to answer that question with, it depends upon where you are.
Okay, or try to transfer, do a test call, maybe.
Yeah, you could do that. As a matter of fact, some people on our working group dialed 988 and one person got a very nice answer and everything, 988, and another person says, I don't know what you're talking about. And the person that dialed was just dialing from a couple different cell phones, and it was the area code that was dropping it into where it got answered, but she dialed from the same desk with different cell phones, and it went into different centers. So the routing is going to be a little sticky. Yeah, it
is going to be a little sticky, but I think that's going to be, that kind of testing is going to be important to understand what your capabilities are today. And then as this progresses, right? How that will change.
Yeah, I thought there'd be a little bit more chatter in here about looking it up by area code, but perhaps it was shocking and people are just not able to type.
It's not, so it didn't surprise them, right?
Oh, that's true. Maybe they're not surprised. Yeah.
All right. Well,
data sets are going to be an important piece here, and I think location identification is going to be a fairly decent debate because using MSEG data and traditional anti-alley database and looking up by area code, I mean, it's not entirely archaic, but it's definitely not going to be the solution for the future state, especially with the number of cell phones moving around with area codes. And there are people that are aware of that, and it is in discussion for hours at a time on how to resolve and solve and move forward on that. But what we can't do is tell people that they need to buy a bunch of new equipment either. So it does have to be something that doesn't overwhelm the infrastructure that's already developed in the call centers.
Right. And even though Hugo mentions they transfer 10-digit, we need a better transfer. I mean, we need a better way to do that kind of business. And that's something that your working group is working on.
Yeah, and Hugo makes a good point. Right now, you waive your privacy, and I just spoke that kind of loosely when you dial 911, but that's not the case in 988. And there are some resources and call centers that are not allowed to have the location identification. And that's likely why Hugo's center sends it over on a 10-digit line, because they're not probably going to have the anti-alley capabilities, nor should they if he's sending it to a place that's not allowed to see that. So there's got to be a little bit of awareness of the permissions around your location and address, and that needs to be followed. And that's sometimes why people use a different line rather than a 911 trunk. And also that a 911 trunk, if it's a CAMA trunk or a next gen EZNet, the ability for someone else to receive it might only be their phone system. So there does have to be an awareness of the disparity of the system architectures and the phones that are out there.
Or even if the network's capable of a short code dial, like 988, right?
Correct.
Sometimes it could just be network constraints.
Correct.
All right. Thank you so much. Thank you so much. So I did put information about the working group in into the chat if anybody is interested.
And
there's plenty of working groups out there.
I'm happy to do introductions and send people to just go do research and answer things and say, I don't know anything about that, but here's who does. And also, if you want to join the working group, you have to fill out a form, get properly invited, or you won't be able to see the videos and some of the resources parked there. And you can join the working group in an observing mode or a participation mode. And we do take attendance so that we can kind of keep moving things along, and you can weigh in on the use cases and the best practices, but don't join the working group to ask a bunch of questions on how you're going to do it at your center. That'll evolve as the working group standards start to do it, and you'll be able to read a use case and answer your questions. So you can read some of those resources to kind of get the ball rolling. Some people are a little worried about what it'll do to their staffing, and rightly so. It is, in some cases, looking things up can take 10 to 15 minutes. And if you're doing that often, 6 calls a day, that's several hours. So we do need to pay attention to that, how we're looking things up. And that is not something that's going to solve overnight. Yeah.
Absolutely. Well, thank you as always, Mo. It was really great information. Always happy to have you at our conference.
Yeah.
Please join our next session. It's indoor mapping best practices. It's at 10 Pacific, so in about 7 minutes. This session is going to talk about indoor mapping best practices for incident response planning. I've seen this one. It's fantastic. Even if you're not a mapping person, I would highly encourage you to join it because you'll learn a lot for sure.
Who's the speaker?
Thank you, everybody. It's Mike Rogers with Critical Response Group.
Cool.
He's awesome. Yeah, you'll enjoy it. You should take a look at it.
Yeah, I saw indoor mapping some time ago, and it was just amazing to me how you can click on some of that and actually turn on a camera and see things going on. Yeah.
Yeah, it's awesome stuff for sure.
Yeah.
Thank you, everybody, for joining.